Welcome to the SIBO Doctor podcast with Dr. Nirala Jacobi, a US-trained naturopathic physician and medical director of the SIBO Doctor, an online education resource for practitioners. In this podcast series, medical experts join us to discuss functional digestive disorders and clinical practice and research as it relates to small intestinal bacterial overgrowth and associated conditions. This podcast is intended for SIBO treating practitioners and aims to help educate how we may best serve our SIBO patients. If you're a practitioner and want to learn everything about SIBO, from the basics to advanced treatments, head over to the SIBODoctor.com. You can also join in the conversation on the SIBO Doctor Practitioner Forum Facebook group. If you're a patient, please note this information is not intended to diagnose or treat medical conditions. Please ask your doctor before initiating any new treatments. And now, over to Dr. Jacobi and the SIBO Doctor podcast.
Welcome, SIBO practitioners, to another episode of the SIBO Doctor podcast. And with me today, I have a return of the wonderful Heidi Turner, who was on this podcast a little over a year ago talking about mast cell activation syndrome. Heidi Turner is a medical nutritionist. She's a medical nutrition therapist at the Seattle Arthritis Clinic at Northwest Hospital, in Seattle. She counsels those with autoimmune, inflammatory, and degenerative diseases in an effort to decrease their pain through dietary change. She specializes in food intolerances, small intestine bacterial overgrowth, and other digestive disorders, mast cell activation syndrome, histamine intolerance, and natural food chemical sensitivities. So truly an expert. Welcome back, Heidi.
Thank you. It's so good to be back, Nirala.
So one of the wonderful, exciting things that's happened is that I connected with Heidi. I think it's got to be now a year ago, or maybe a little less than a year ago. But I was so impressed with your presentation at the SIBO conference in Chicago last year that I said, "All right, let's do something together and create a biphasic protocol for histamine intolerance." And thankfully, you agreed. And we're actually wanting to introduce the Histamine Bi-Phasic diet, which is now completed, and we're releasing it in July, so very, very soon. And this podcast is sort of a little teaser to a webinar we'll be co-presenting on when we're releasing this diet together, which is much like the Biphasic diet, a free tool for you, the practitioner. So Heidi, tell us a little bit more about histamine intolerance and what you're seeing in your practice and why we really created this diet.
Yeah, sure. Well, histamine intolerance is an issue that I see really prevalent in those with SIBO. And, it's a situation where we have obviously a lot of intestinal inflammation in relation to the bacterial overgrowth itself, or the dysbiosis. And that inflammation then compromises the amount of diamine oxidase that the intestinal cells produce. And that diamine oxidase is that enzyme that helps us to break down histamines that are found naturally or through fermentation processes in foods. And so oftentimes if we're taking in a lot of dietary histamine and we don't have a lot of DAO present because of that intestinal inflammation, then we might not be able to break that histamine down adequately enough. And that causes an absorption of histamine into our system. Not only can that histamine increase more inflammation in the gut, but we can also see a rise in systemic histamine. And that can then start to create then other symptoms. And other symptoms can be, hives or congestion or a migraine or hypotension or, severe fatigue, any number of symptoms that are related to excessive elevation of histamine in the blood. So it's very common to see this type of intolerance. And one of the reasons I think this diet's really important, the diet basically, why we created it, is because The issue with a low fermentation diet, which is where we take out FODMAPs and starches and fermentable foods that the bacteria like to feed on, is that they are all inherently high in histamine. So, a low FODMAP or fermented foods like fermentable foods like tomatoes or eggplant or spinach, which are all really allowed on a low fermentable diet, are exceptionally high in histamine. So when we restrict the diet in such a way that all of a sudden now we're flooding all of this, these histamine-rich foods into the gut that isn't adequately making the amount of DAO that's necessary to break that histamine down, then it could be exacerbating that intestinal inflammation. And then that's when we might also see those more, external manifestations or systemic manifestations of the SIBO.
Mm. And definitely, this is something that I have seen very, very much of and have talked about a lot, lectured on, and taught practitioners about histamine intolerance. And, one of the reasons I created the biphasic protocol, which is really a way for the practitioner to organize their thoughts. It was not that I created a brand new diet. I just used the SIBO-specific diet from Dr. Seebecker and a little bit of other features from the low fermentable diets and sort of created it in a more palatable, for practitioners, I should say, usable format so that there's really are very distinct phases. And so what we did, and I thought it would really lend itself really well to the histamine intolerance or SIBO-Biphasic diet, was to also have a two-phased approach, but rather than reduce and repair and then basically killing phase and all of that, it's really a pre-step to the SIBO-Biphasic diet. It's more a way of identifying what foods are really problematic. And for those of you who are not really familiar with histamines and foods, there's actually two categories, and maybe you could elaborate a little bit more on this, but they're histamine-containing foods, and then there are foods that are liberating histamine in other foods.
And that's exactly right. Yeah. So there are foods that just, contain histamine, whether that is through the fermentation process. So let's say you're going to make sauerkraut or kimchi or wine or beer or anything else that you ferment. Then you're going to get a certain level of histamine production from that bacterial fermentation. So you basically need the amino acid histidine, and you combine it with the histidine decarboxylase, which is the enzyme the bacteria uses, and then you make histamine from that. So foods that are really high in histamine are those fermented foods that have already been fermented. And then we also have foods that are sort of naturally high in histamine. That would be like tomatoes or spinach. And then we have this whole kind of subcategory, which is that these are foods that are histamine liberating foods. And these are foods that can either stimulate a histamine reaction in the body. So we can, like for instance, eggs are a food that don't necessarily contain a lot of histamine, but that can trigger a histamine response. So we consider those histamine liberating foods. There are also foods that are under that histamine liberating umbrella, like oranges contain a particular biologic or biogenic amine that is not necessarily histamine, but that it is part of that family. And so it can trigger that kind of similar response. So it doesn't necessarily contain histamine, but it sort of can encourage the same types of response physiologically.
And so in your practice, just a little sidestep back to clinical realities, what kind of foods in that category of histamine liberators do you find most problematic?
Oh, well, okay. So if I had to kind of do tiers with it, definitely the histamine foods, obviously like the tomatoes and the spinach, the ones that actually contain histamine, I find to be across the board the most problematic. So like those are the ones that we usually will look to introduce in last because they do contain majority of the histamines. That's actual histamine coming through. When we're working at histamine liberating foods, that is really dependent upon the individual. And so, for instance, citrus, I'd say it's like 50-50. Some, it really makes a big difference when they take it in, and it really triggers that histamine response in them. And for others, they can eat as much of it as they like. So, or strawberries or raspberries or, any number of these other, or pork or any number of these other foods that have that liberating effect. It really does depend upon the individual and, and what is going to impact them. And that's why when we did this particular diet, the way we did it is that we said, okay, look, we're going to take out the histamine foods. That's a no-brainer, but we're also going to take out these histamine liberating foods. And then as you get further into the first phase of this low histamine fermentable diet, then what we're going to do is we're going to start to introduce in those histamine liberating foods first, because that's all variable on the individual. And you might be limiting foods out of your diet that you really should not be limiting because they just don't really impact you. So those are the ones that we really want to start bringing in sooner than later to really figure out your individual response to those foods.
And really, as just reiterating to the practitioners listening to this, is that the goal is not to keep your patient on a low histamine diet forever. It's really about identifying which foods are problematic so that you can then move them through SIBO treatment a lot more, I think, in a way where you can see, oh, those were just histamine symptoms rather than, oh, those are SIBO symptoms. And certainly not every patient needs to go through the low histamine diet, but there are just some classic food reactions that we find difficult to manage even just on the biphasic diet, and even if I just take out spinach. So it was really yet another way of creating a useful tool for myself, really, because I see patients that are extremely sensitive. And to really have a guideline of, okay, these are the foods for the first 2 weeks only or so, that 2 to 4 weeks that you need to avoid. And then you can start to reintroduce some of these foods before we really start with really active SIBO treatment. Because one of the things that we also find with those patients that are very sensitive or intolerant to histamine, they are also the ones that often react the most to treatment in terms of antimicrobials and different aspects of our gut rehab treatment. Do you find that as well?
Oh, absolutely. Yeah, absolutely. And like to your point, not everybody needs to take all of the histamines out of the diet. That isn't necessary for every person who has SIBO. Not every person who has SIBO has histamine intolerance. So for some, just the straight up biphasic diet is enough. Just taking out those fermentable starches and FODMAPs and foods is enough. It's when there's that, there's more of that sensitivity exactly to the treatments, or that there are other more systemic manifestations that you're seing, or they're on that particular diet and they're just doing worse on that diet. There's different, not every population who has SIBO is going to need this diet, but this is what I feel like this is a really critical tool, because because in most cases, the other diet's going to be fine, but for the cases where it's not, where there's severe sensitivity, where we're seeing all these other manifestations, then you have something to really work with. And you can then kind of, yes, it's a more restricted diet. And that's one of the downsides to doing, this work, but it's a short-term diet. It's just to get in, see if we can't calm the response, and then build from there so that you can really get a sense of which foods are the most problematic ones. Because maybe it's just that they've been drinking a ton of kombucha, or maybe it's eggs.
I get those, yes.
Right? I'm supposed to drink a lot of fermented foods because they're good for my gut,
Yeah.
Or they've been eating a ton of eggs, right? Because eggs are, what else are you going to have for breakfast? Like all of a sudden we start to favor a lot of these foods that either are high in histamine or histamine liberating. And so I think what this can help the practitioner do and help the patient do is to sort that out if they're not doing well on that biphasic approach, or if they already have these other manifestations that indicate that there's some histamine issues going on.
So, one of the questions I know we're going to get is that, there are tons of histamine diets out on the market already. And
Right.
why did we create this one, and where did we source our materials? So, for me, I really want to emphasize that I wanted to create something that precedes the biphasic treatment of SIBO if people are super sensitive. But maybe you can answer the second part in terms of, because you have so much experience, far more than me, of treating people with histamine intolerance and mast cell activation syndrome, and also where you work and all of that. So
Sure.
you have a lot of resources available to you, don't you?
I, I do, and they all contradict each other. This is like, when I first started working with histamine diets 15 years ago, Royal Prince Alfred Hospital in Sydney was the only game in town. That was it. So that's where I learned. That's was through their program. And so when I started working with like salicylates and histamines, that was it. It was, okay, this is what a histamine is, and this is where it is, and this is how you do it. And, it's been in the last really 5 to 10 years where there's been this, the internet, right? The big explosion of understanding and popularity, and, everyone really, getting more into the research around histamines. And that's all of a sudden it was sort of like, wait a minute, what happened? Wait a minute. It just kind of, turned my world upside down, because it was working just fine before. But now, wait a minute, cashews are high histamine. They were always the low histamine nut. It was really frustrating. So, as we were working on this together, I started looking at all the different, organizations that are relatively well respected, and looking, and that they do contradict each other as well. So we looked at the Swiss Interest Group. We looked, back to Royal Prince Alfred Hospital and International Society of DAO Deficiency, and just kind of looked and kind of gathered all of this information, and really saw where things crossed. And like nobody. Everybody can agree on the high histamine foods, like, what actually contains histamine. It's more of the histamine liberating foods. And I think that's where confusion comes in. And they're all sort of classified under one umbrella of, this is a histamine food. And I think that's where it gets a little messy. So what we basically did is we just kind of brought it all together, and, crossed off, where the fermentables were, and then, found sort of a common ground of, like, obviously the high fermented foods are out. Now what's left? Well, okay, we're also trying to kind of create a diet that people are going to actually be able to eat. If you took every last little piece of these lists off, you're left with nothing. You're left with like chicken. It's just chicken for 2 weeks. It's low histamine. Great, and like, okay, now what do we do? So we really had to kind of still keep a certain level of, obviously we kept carrots and, the things that everyone can agree upon. But there were certain ones like, kale is on some high histamine lists or histamine liberating lists, and we decided to keep. Chard is on some lists we decided to keep. So there are certain ones that we were like, look, let's just keep certain ones, even though we can't really determine exactly how much histamine is in that particular food. We have to keep a certain level of variety alive here. And what I also know just clinically is, and I kind of took all of that information and also kind of combined it with my clinical experience, but that, there's a certain level of tolerance to most of these foods. Histamines rarely work like, it's not just one histamine food that you're going to react to. It's usually the combination. You have to reach a threshold, because it really has to do with that level of DAO that you're producing. So, generally you're going to be able to, if you just take down the load of histamine, that is low histamine enough to shift down that reaction that you're having. So even if, you look at the diet and go, well, wait a minute, kale, I thought that was a high histamine thing. It's like, it's okay. It's okay. It's all right. I haven't found any, literature to support that it is. Clinically, I typically don't see it being problematic. And so I think we can, and it is a low fermentable, so let's just keep it there. Certainly, if you find that you have issues with any of, the foods, for the most part, it is low histamine liberating. If there are a few things that are there, then you just keep those out and you keep moving.
And you keep moving. That's it.
Keep moving forward.
And
more.
I just think that it's going to be such an incredible tool, and I'm really excited because we've worked on this for so long. We've edited a few iterations of this diet and had it then, now I'm just really excited to give it to practitioners and see how they can help their patients with it. And so it is, the handout is free to download on the SIBODoctor.com, also from your website, I think, Heidi, which we'll get to in a moment. But I do encourage people that need a bit more guidance to step through this, because it's not just here, put your patients on this diet and keep them there and then initiate SIBO treatment. It really, you need to understand how to implement the diet and also how to then get out of the diet, so that what we know from severe food restriction long-term is not good for the microbiome. So we really do emphasize that it is a therapeutic tool to use in clinic. And for those of you who want to learn how to really implement it properly, the live webinar, we've just decided on the date, is July 12th which is a Thursday in America, and that translates to Friday, the 13th of July for us in Australia. And for those of you listening after this date, the podcast will have been recorded and is still available on the SIBODoctor.com. So do you have anything else to add to this, Heidi, in terms of how we came about it, or what your experience is already using the diet, or anything else you want to add?
Yeah, I have been using the diet, and it is such, I just have to say, it's a great resource because I had my own version for a while, but we've really, gone out there and really collected, quite a lot of information and really combed through. And I think that we've created something that I think is a really invaluable tool. And I think it's a really important tool for any practitioner and for, anyone who has both SIBO and histamine intolerance. I think I like it. And I've been using it on some of my patients, and they really appreciate it a lot. We've got menu recommendations as well, just to kind of help support that. So, they're not completely lost in trying to figure out, how to put everything together. So, but so far it's been, really lovely to have this resource. So I'm really excited to be a part of this and to be able to, to provide this to practitioners and to patients alike.
Fantastic. And where can people find you? I know that you're working in Seattle, but you also have your own website and your own business, right?
I do. Yeah. I have a telehealth Skype-based practice at foodlogic.org. And if you're local and you live in Seattle, then I do have clinical hours at the Seattle Arthritis Clinic, where I see patients privately as well.
Wonderful. And all of that information will also be available in the show notes. And look, we really hope that you're going to join us for this webinar. It's going to be a lot of information, and we're going to have a live Q&A afterwards. And we're always anticipating people's questions. We have a lot of experience with histamine intolerance, so we hope that we can make your practice easier, because I actually just had a conversation with another practitioner about how more frequently we are seeing histamine intolerance just generally across the board. And part of that, I think, is just people's buckets, so to speak, is just getting fuller and fuller, and they just can't clear histamine from their system as much. But part of it is also because of this digestive disruption. So I do really appreciate your expertise in this, Heidi, and really look forward in a joint presentation with you. That'll be a first, actually.
I know. I can't wait. I'm looking forward to it, too.
All right. Great. Wonderful. We'll see you on July 12th or 13th, depending on which country you live in, or if you're listening to it, it'll be available on the website. Until then, keep up the good work. If you've liked this podcast, please give us a review on iTunes. Join the conversation in this Facebook group called the SIBO Doctor Practitioner Forum, where we have a lively debates about different cases and topics, etc. So until then, we'll see you later. Bye, Heidi.
Bye-bye, Nirala.
Thank you for listening to the SIBO Doctor podcast. We hope you found the information in this episode useful in the treatment of your SIBO patients. Thanks to our sponsors, SIBOtest.com, a breath testing service with easy online ordering, and Quintron, maker of outstanding breath testing equipment. Tune in again for another episode of the SIBO Doctor podcast. Thanks again for listening.